Recent estimates indicate that nearly twice as many people are experiencing mental health concerns in the wake of COVID and the financial uncertainty that it's brought. To show the possible cost of that, if the same rate matriculates to deaths of despair like drug overdoses and suicides, we are on track to lose more lives to the psychological effects of the virus than the biological ones. And to prevent that, we have to act now and with good data. I'm Glenn Coppersmith. I'm the founder and CEO of Qntfy, and for more than 5 years we've been operating at the intersection of human behavior and data science. We're an entirely bootstrapped company, revenue positive from day one, and operating a fully distributed team of 19. Our clients include Fortune 100 companies, DARPA, and one former US president. NASA, just like the rest of us, is trying to address their core mission with a workforce that is at best distracted and at worst cognitively compromised. So we see a national need and an opportunity to better understand how individuals and groups can thrive in isolation, similar to some of the proposed NASA missions with a human crew. Work here will support our people operating in isolation today and the astronauts training for isolation tomorrow. And more broadly, we can provide critical information about the trade-off between the biological and psychological costs of our policies and programs. All the research we have about resilience and recovery are from a pre-COVID world when our society looked very different. And so as much as we need better data about the biology of the virus, we also need better data about the mental health and well-being of the population at scale and in real time if we're going to make smart decisions here. So Qntfy uses digital life data to get real-time estimates of people's well-being. At the core of this technology is the ability to take things we generate in our everyday lives, like language on social media or actigraphy from our wearables, and turn it into information about our mental health. We can quantify the effects of social distancing and isolation and use it to shape the new normal. We provide organizations and policymakers with actionable insights via always-on reporting and in-depth strategic guidance, filling a need for real-time information while preserving privacy. For example, we use our tech in partnership with the George W. Bush Center's Military Service Initiative to more precisely understand the well-being of veterans and enrich their lives. This is all powered by our proprietary analytics that use tens of thousands of linguistic and non-linguistic signals derived via machine learning and natural language processing from a diverse population. And the signals here are probably not the ones that you're thinking of. This isn't someone talking about having depression or anxiety or thoughts of suicide. It's how often they say things like I and we, which words they use to convey emotion, and their use of emoji. Many of these analytics have been peer-reviewed and published if you want a more in-depth understanding of how they work. It's worth noting that this is not restricted to text or social media, and we have similar capabilities for audio and images too. So we also use this tech to directly improve people's well-being, and know that right now, in partnership with the Erica Legacy Foundation, we're providing personalized support to the healthcare providers on the front lines of this pandemic and the people that are currently stuck in isolation. So if you want a partner to provide support in this time of need, or if you need precision guidance about a group's well-being, come find us. We can quantify that.